Hi, everyone. Abby here, directly after Mayor Machicki. No pressure there. Yeah, so I'm Abby. I'm an independent consultant here in the community. I have several contracts, some of them being statewide contracts, some local. This project particularly is a local project. I just want to put out there that I'm here talking about it today, but this has been really a community collaborative effort. Various coalitions, agencies, and resources have come together so far in the process to launch 100% communities. So I don't want to take all the credit, although I'm here speaking about it. I lead SAFER, which is an alliance here locally. It's an upstream prevention work group looking at how we can connect families in our community to more resources, getting parents plugged into support and resources to essentially prevent maltreatment, domestic violence, all of those things that unfortunately are happening every single day in our homes. And SAFER sits underneath Change for the Kenai currently, which is a local substance misuse prevention and awareness for opioid use coalition. And then I'll share a little bit more about Alaska Impact Alliance. In fact, that's another project that I'm involved with at the statewide level, and they have come alongside this effort here locally and supported it immensely here locally, as well as some other communities across the state. So let me see if I can do this. Oh, next slide. Sorry. Okay, so yeah, perfect. So 100% communities, I'll share what it is, but it's essentially a model out of New Mexico. We chose it for a lot of reasons, and I will say primarily because of its focus on the social determinants of health. So those are the things that are around us that essentially determine our quality of life, our ability to thrive, our physical health, our mental health, all of those things. And I really appreciated this quote here. It says your longevity and health are more determined by your zip code than by your genetic code. And it really is true. So that was one of the pieces to this model that we really liked as a prevention collective. Next slide, please. The other piece that was really appealing about this model is that the needs assessment is really step zero. It was a huge project to launch and carry through, but it's really just the starting point of the efforts. The meat and potatoes of this model is in building out action teams and really looking at what are the access issues in a community, and building teams around that. Experts, subject matter experts, people that care and are passionate about certain topics. And what I like here down on the bottom is really looking at understanding how services are connected and addressing barriers to access that families experience. So that word connection is through and through throughout all of this model. So what is 100%? It's, as I mentioned, it's a model out of New Mexico. They have it going across the entire state there at the county level. This actually came out of a tragedy, this entire model. There was a little girl named Anna who was 8 years old, in and out of the system, the OCS, CPS system, released home to her bio family and unfortunately abused to death. So essentially leaders in New Mexico came together. They looked at Anna's case and unfortunately many other cases and looked at what could we have done to prevent this. And that's how this entire project or model was created. So what they essentially found was that in order for a community to survive, there should be 10 vital services. Those are listed here. 5 of them are considered survival. So you've got your medical and dental, your behavioral health, housing, food security, and transportation. The other 5 are considered thriving. So you've got parent supports, early childhood education, community schools, youth mentor programs, and job training. When a community has access, can afford, and easily navigate these 10 vital services, all the bad things are going to be reduced. The substance misuse, the mental health, the domestic violence, the child maltreatment. When families or individuals can access these services and navigate a system efficiently, we're going to see reductions in all of those things. So I'm not going to spend a lot of time here, but this is kind of the step process I just want to share. It's so much beyond a community needs assessment. It takes it so much deeper and really looks at how we can make changes unique, innovative changes here in our community. And so this is the report. This is something that Alaska Impact Alliance has come alongside us to help with. They took our data from our survey and created a really nice dashboard to kind of look at what our survey results show here. If you want to go ahead. We had 974 fully completed surveys, but over 2,000 that were somewhat completed. So we took those 974. You can go to the next slide. And this is the breakdown. I apologize. It's probably not the easiest to see on here, but I'm happy to send this out. These are where we scored with access here in our area amongst those 10 vital services. The next step in the process, really in the model, is to then build out 10 action teams. So as I mentioned, getting together some of those individuals that work in these fields, are passionate, have lived experience, whatever that may be, identifying those people and bringing them together to look at their data and then make some plans moving forward. So we now have 10 action teams developed here in our community. 5 of those were already in place. So I want to be clear that this was not something, we're not replicating more meetings, we're not creating more groups that are talking about the same thing. We really looked at what's already in place, and then of those, what do we need to create here? So most of the survival services actually already had groups in place. We were able to meet with them and bring them under this umbrella. Go ahead. And one more. So Alaska Impact Alliance, for those of you that aren't familiar, this is a statewide of lots of practitioners and individuals across the state, essentially looking at safely reducing the need for OCS involvement. So looking at ways to get upstream of this, keeping kids from entering the system. And so when they heard about what we were doing, they were extremely interested, especially knowing kind of the impact this has had in New Mexico with child welfare reform. Go to the next one, and one more. Sorry, I'm trying to speed through this. So they came alongside our work, and they enhanced in several ways. They took our survey, which we took directly from the actual New Mexico model, and enhanced it. And I'll show you what that looks like. They helped us with community reports. They've built out an online community dashboard and a resource navigation dashboard. So next slide. So this is an example of how they took our survey and ran with it. So this is from actually Metlakatla, just launched theirs and completed it in Juneau. And there are several other communities across the state that are now taking this on. But if you look here, you see, I think it's 92% reported needing medical care. 66% of those had a difficult time accessing it. And they took it a step further as to what were the access issues. So their action teams essentially have more data than we do in our initial round. So going forward, when we relaunch this, we will be using the enhanced survey just to collect a little bit more data there. And same with mental health. Similar concept, really get into the nuts and bolts of why are there access issues in a community. Okay, and this is the online community dashboard. As I mentioned, they created that report and now have it on their website. This is the Alaska Impact Alliance website. Any community across the state will be joining, and their dashboard will be shown here. Go ahead. So you can see ours is up. Juneau is just about to get theirs, and I believe now Metlakatla is up. So this is kind of a old slide. But moving forward, what they've done, in addition, I mentioned resource navigation. So they've looked at how can we now pull from those action teams, what are the resources within each of those vital services? You can go one more. So they built out online, you can click in an area and they're all broken out by vital service. So all 10 of the services, if you go one more, I basically showed just screenshots. It's the same thing, but 5 screenshots of the survival services. And several of us locally, we looked at some community guides. We worked with our action teams. And this is something that'll be updated on an annual basis by our action teams. We'd like to take it a step further. There's some interest in a potential app being developed, but essentially this is trying to find an easier way, a more user-friendly online resource to help people navigate the system, get plugged in, and seek the care that they need. Go ahead. Keep going. One more. One more. Okay. All right. Sorry, what time is it? I want to make sure. Okay. So you can see here, so this so far has been an unfunded project. As I mentioned, it's been several of us working together, coalitions coming together to build this out. I just actually presented on this at the Transportation Gaps and Solutions meeting as well. And then Lynn Cassidy and KPED are doing something similar. So looking at how we can merge and collaborate, not duplicate efforts. I say that because essentially what this model is trying to do is bring all of these vital services under one team. So often in the meetings that I'm in and the work that I'm doing locally and statewide, I'm just seeing such a duplication of efforts. I'm seeing competitive efforts for grant funding and different things that we could really be collaborating on instead of fighting over funding. There's just such an opportunity here to bring all of these really vital services under one. And the whole concept here is that each team would meet monthly, which is already happening. And then we'd have a quarterly team lead meeting. And those leads would come together and talk about the bigger picture and how we could be collaborating better. For example, the food bank, they have a program coming out for 18 and under food through the summer, 7 meals a week. The opportunity there for the food bank to come to 100% communities as a whole, share that program and figure out how within each action team we can support that program, whether that's finding sites for those meals, getting word out in the communities and the schools, and just different ways that we can support as opposed to just working in such silos. I really truly believe that's the magic in this model and something that we're missing here in our community. You talk about development and different things and, you know, just being able to have an understanding of what is happening here in the developmental world and how we can make stuff more accessible to with some of these as well. So I just want to put that out there that that's kind of, you know, something I learned with Cassidy just recently, and we're going to have a conversation about really trying to avoid duplication in our community. So next steps, really looking at that resource navigation piece. Do we move forward with ours? What is KPED doing? How could we merge or collaborate? Exploration of local and statewide partners. That's going to be a big part of this. And finally, ideally, we'd like to take this borough-wide. At this point in time, this has been for the central Kenai Peninsula, truthfully just because of capacity. But I think if we want to do this really well, this would be a borough-wide project. And ideally, we would find funding to hire a coordinator to oversee that and build it out. So that is probably over the next few months a big project of ours. So that is, I believe it. I have, okay, there we go. Dr. Charity Carmody with the Alaska Impact Alliance here, her contact, and then mine. I'm local, live here, born and raised here in Soldotna, so happy to meet and chat at any time. Thank you.